Does your child have borderline personality disorder, or is it just their addiction? Parents, if your son or daughter is using illicit substances and you're seeing a lot of mood swings, you might think it's borderline personality disorder, but it may not be. And let's talk about why. When a person is battling addiction, the side effects of the substances they're using can present as a mental health disorder, especially something like BPD, extreme mood changes, fear of abandonment, and identity confusion. According to the Cleveland Clinic, borderline personality disorder is marked by extreme mood swings, unstable relationships, and trouble controlling emotions. Here's the key: if your child is actively using, you can't necessarily rely on a borderline personality disorder diagnosis just yet. The substance use side effects may be creating the same symptoms. Research warns that personality disorder diagnoses are often inaccurate during untreated mood or substance use episodes. So how does BPD differ from something like bipolar or just the chaos of addiction? With bipolar, mood episodes tend to last days or weeks. With borderline, the mood swings can shift in minutes or hours, and they're often triggered by fear of abandonment or relationship stress. For example, the Mayo Clinic notes that borderline involves rapid shifts in mood, identity, and relationships. Many with BPD have a history of early trauma, neglect, abandonment, and unstable caregiving. That fear of being left alone becomes wired into their emotional response system. The Cleveland Clinic mentions adverse childhood experiences such as neglect or a loss of a caregiver as risk factors. And when you add substance use, you increase the risk. The substances make emotional regulation worse. The trauma history makes impulsivity more likely. So as a parent, you have to ask, are these symptoms because of addiction, or is there a deeper personality disorder underneath? Whether it's addiction or BPD, there is hope. But the treatment is different and the timing is important. If your child is using, the first priority is addiction treatment, aftercare, sober living. Once the substance use is under control, a professional can assess the mental health situation more accurately. If it is BPD, therapy has come a long way. DBT, or dialectical behavioral therapy, helps with emotional regulation, impulse control, and relationship stability. With consistent therapy, many people with BPD do learn how to not only cope, but thrive. If your child is still actively using, I want you to focus on getting them into a treatment center first where they can get the appropriate care for their substance use disorder. Save this video and share it with another parent who's maybe wondering, is this addiction or something more? Comment below, which symptom are you seeing that worries you the most? Parents, no matter what you're going through with your child, there is a path forward. There is hope, and you're not in this alone. Follow me for more tips on how to deal with your child battling drug or alcohol addiction.